Babies can't tell you that they're sick. They can't speak for themselves. When they're born, they get newborn screening. So newborn screening is actually a diagnostic test. They take a small drop or two of heel stick blood, collect it onto a filter paper, and they send it to a state laboratory that does the testing. My laboratory actually tests for amino acids or inborn errors of metabolism. And one of the disorders that we screen for is called PKU. And PKU is really an inborn error of metabolism in newborn babies and even children where they're missing an enzyme, or an enzyme is not as active as it would be in normal patients. It's not rare. It's about 1 in 15,000 babies that are born with this in the United States. And it's important that we catch these diseases at birth, because if they're diagnosed, they get them on a special diet, they can treat this and manage it, and those patients grow to productive adults. If not, it can be permanent brain damage, it can be death even. We're fortunate in the United States that every patient that's born goes through a screening so we can catch these disorders at birth. Unfortunately, there's not standardization between the different states. So some states screen for more diseases than others. Parents can make sure that their physicians are aware of the laws, are aware of newborn screening, and if the state does not screen for particular disorders, talk about their descendants and their families, what types of carriers they may be, diseases in their relatives that might be inherited that they can screen for at birth or even before birth, now with DNA and genomic testing. I'm Dr. James Nichols. I'm a medical director of clinical chemistry and point of care testing, and I'm a professor of pathology, microbiology, and immunology at Vanderbilt University School of Medicine in Nashville, Tennessee.